Hello, everyone. Why do we feel bloated in our stomach? What are some of the underlying causes and natural remedies for bloating? We'll go over this topic in our session today with Dr. Preeti Kulkarni, a naturopathic doctor who runs an integrative and naturopathic medical center in the San Francisco Bay Area for the last 13 years. Well, she is my neighbor, so that's great. She combines current scientific research, naturopathic principles, and each patient's unique requirements in her treatment protocols. I am Amita from Nourish Doc, a platform for natural and integrative therapies. I'm excited to introduce all of you to Dr. Kulkarni. Welcome, Dr. Preeti.
Hi, Amita. Thank you for having me here today.
All right, so let's get started. Could you just talk about what exactly is bloating?
Yes, of course. So bloating is actually a sensation that a patient experiences. It's a sensation of abdominal fullness, almost like their abdomen has been distended. And medically, we define it as a distended abdomen full of gas. It's because of excessive gas. For a patient, it doesn't always have to distend. They can also just feel it as a sensation. Visually, sometimes you see it as an actual distended belly. And sometimes we don't see the distension as much. Like we can actually measure their belly and we don't see the distension, but the patient is still experiencing that kind of an excessive gas feeling, a fullness feeling in their abdomen, and that's still considered bloating. And basically, the underlying cause is excessive gas, and that's not being able that they're not able to release either through burping or through passing gas. Often it's experienced as a combination of symptoms. It's not just gas, but it comes up as patients often tell me, I always burp after I eat, or I have to pass gas after I eat, otherwise I don't feel full, I keep feeling bloated. Sometimes it comes in combination with abdominal pain and discomfort. Even though they might not see a distension, they might still feel a lot of discomfort, not always cramping, but just a feeling of sensation of being full. It's like I've eaten a huge meal and nothing seems to be moving, that kind of a sensation. Sometimes it even comes with gurgles, and often patients mistake it for being an accumulation of fluid, but it's not. It's just the gas that's moving the fluids that are already present in your gut. So people will often say, I always hear gurgles after I eat and I feel bloated, I feel like my tummy is full, and that's usually the gas that's moving the fluids that are already there. So it's not an excess accumulation of fluids, it's typically accumulation of gas. And sometimes we also see bloating that's happening along with weight issues. Like people often tell me that I can gain about 3 pounds after a meal, and I feel that's because the food is just sitting there. It's because I feel like a sensation of my belly being distended, and I've gained 3 pounds after eating a meal. And I also included one thing, that is body image issues. Often we find that patients who are very sensitive to body image issues feel that even if there is a slight distension of their abdomen, they consider it bloating. And that is still bloating, but it's normal to have a little bit of bloating specifically after a meal, but it should calm down on its own. If it doesn't go away, that's when we would classify it as a medical condition of bloating.
So when is the immediate attention by your doctor? Do we have to call the doctor or something? I mean, what exactly at the point is when a doctor is needed?
So most people will experience bloating at some point. And like I said, a little bit of bloating is normal after a meal, especially after a heavy meal or a fatty meal. A lot of people experience bloating around the holidays when there is a tendency to overeat when with your families and friends. So a little bit of bloating may not be abnormal. However, if it's accompanied by a lot of discomfort and when it doesn't go away on its own, plus there are severe symptoms like if there is diarrhea accompanying the bloating or if there is constipation. And when I say constipation, it's not just skipping one day of bowel movements. If a patient has been bloated and hasn't been able to go to the bathroom for over 2 days, that's not a good thing. Or if they're seeing blood or mucus in their stools, or if they have excessive amount of cramping, which is different than just discomfort, when they actually experience pain that's not going away, all of those reasons are something that you need to seek immediate attention for. If it's not resolving, you need to call your doctor, or if it has other symptoms that are severe enough that need immediate attention, you should be calling your doctor, even if it's just to ask what to do next.
Okay, so what are some of the remedies that you can recommend for immediate relief?
So, as I mentioned, a lot of people experience bloating after a meal. And if it's not as severe, or if it's just something that they know that it's happening after a meal, they can try some of the home remedies. You typically, I recommend trying some mint tea, because mint can move gas. Anything that moves the gas, there are simple everyday kitchen herbs that can help move the gas along. Mint, fennel, ginger, all of these things can move the gas and help you pass the gas. Or maybe it might even make them have a bowel movement. And this kind of goes along with the naturopathic principle of treating the root cause. If somebody is bloated because they feel like the food is just sitting there, if they're constipated and they would feel better after having a bowel movement, then treat that. Then you would have something like aloe vera that would help you go to the bathroom and then relieve the gas. So that use something that'll help you relieve the underlying cause, and you will be able to pass the gas or burp it up. Those are usually the common things that I would recommend if a patient calls in saying, this is what's happening. I also tell my patients to try something like apple cider vinegar. If they have a common problem, like after every meal, they have that sensation of bloating, it may just be because their body is not digesting their foods very well, in which case we would recommend enzymes, digestive enzymes that they could use, or maybe just apple cider vinegar, because apple cider vinegar does a great job of stimulating your own stomach acid and your digestive juices. So you could start with that and see if that helps. Sometimes if it's a little bit more discomfort, then even trying some regular over-the-counter medications. Some people try Tums, some people try Pepcid or Prilosec. Even that should work if it's a matter of just relieving minor bloating. Belly massage is a really good way of doing it naturally. Just having a warm pack on your belly and then massaging your belly in a clockwise direction, that can move the gas, physically, and that can help provide relief as well. So these are some of the natural things that people can do if you're just feeling that sensation of fullness, and that it's because of a certain meal that you ate, or that it happens at a certain time of the day, and you will get relief if it is something minor and related to just passing or releasing the gas from your abdomen or having a bowel movement. A lot of these things can actually provide relief. And I did put in activated charcoal in them. That is something you should talk to your doctor before you use it, because activated charcoal actually absorbs the gas. But it is something that's a little bit more potent, and it can absorb other things. So, and it can also attach to other nutrients that are actually meant for you to be absorbed, but instead it can absorb it and then take it out of your system. So it is something that you need to use with supervision. But if your doctor has allowed you in the past to use it, that's something that you can utilize as well for bloating.
And the magnesium supplement, you mentioned that as well. That also they need to talk to a doctor, or we can take
So
ourselves?
Magnesium, that's a good question. Actually, magnesium, it's not as harmful to try. They can still try it at a lower dose. The dosage is something you should discuss with your doctor, because people can be sensitive to how much magnesium they can have. Generally, I use magnesium with my patients who are constipated, and that tends to be their underlying cause for bloating. Magnesium citrate is a very good thing to use for constipation. And depending on the patient, the dose can vary between 200 milligrams to 600 milligrams. Some patients can get diarrhea even with 200 milligrams, and that's why you have to be careful with the amount that you use. But yes, magnesium definitely can help move things along. Magnesium actually helps to relax the abdominal muscles, and that's what will help to move things. So if everything is really tight and your body is unable to relax, then you tend to hold on even to gas. And so as soon as you take magnesium, things tend to relax, and you'll be able to pass the gas and relieve of the bloating as well.
And you mentioned about the apple cider vinegar. So should we take like a teaspoon in water, a warm water? How much should anyone actually take apple cider vinegar?
So apple cider vinegar, generally what I recommend my patients to do is take about 1 teaspoon mixed in about 2 ounces of water in warm water right before their meals. Take it maybe about 10 minutes before a meal. And the way I describe it to them is mix your apple cider vinegar with water, drink it, and then set your table. By the time you get your food ready, that's when, and that's enough time for it to actually have done its job, and then you can start eating. So about 10 minutes before a meal is a good time to take it.
Okay, let's move on. And if someone is having a chronic problem, with bloating, so what should that person do? And let's see your doctor, of course, and what would be the underlying causes for that?
So typically when a person is having bloating, regularly. So it happens after every single meal. It's happening very often. And there are, of course, medical criteria that we use to diagnose people who have just bloating versus functional bloating, or if it's actually part of a bigger problem, which is, it could be part of a bigger diagnosis. That is something that we need to investigate when it becomes a chronic issue. So if you experience bloating daily, or even 3 times a week, but it's happening consistently, and that continues to happen for at least 3 months in a row, it is something that you need to, and I'm saying this is without any of the diarrhea or any of the other things we mentioned before, where they don't have bloody stools, they don't have excessive constipation or diarrhea, but just bloating, like low grade bloating that's happening either on a daily or a weekly basis, and it's happening consistently. Then it is important to figure out why it's happening. And that is something I always tell my patients: we want to figure out why, so that we can address the underlying cause, and you don't have to continue to depend on, just daily remedies. Like, you don't have to keep drinking ginger tea every day just to relieve your bloating. You don't have to keep taking magnesium just to relieve bloating. Let's find out what's causing it. And of course, you want to rule out, if depending on the intensity, the frequency of the symptoms, and at the same time any accompanying symptoms, we want to rule out things like, simple things first, like if there is, candida overgrowth. Sometimes that can cause bloating. Sometimes it's a simple thing about, maybe they have celiac disease and it's never been investigated. Maybe there's somebody who naturally has less amount of gluten in their diet, so they never experience severe symptoms, but bloating is something they see when they do happen to eat wheat products. I see this sometimes in my Asian patients whose diet is based heavily on rice, so they don't eat as much wheat, so they don't typically get diagnosed with celiac in their early years. But we often find that either they have a carrier gene or they do have celiac disease. It's just that they've not naturally not eaten wheat as much, and so haven't experienced too many symptoms. So things that we need to rule out first are if they have celiac disease, or if they're a carrier for celiac disease. If they actually have inflammatory bowel disease, typically they will show an additional symptom in addition to bloating. And more than likely, it would be something like blood in the stools, even if it's not very often. They would also see some mucus in the stools. They would see abdominal cramping. There's often intense amount of pain associated with patients who have inflammatory bowel disease, in which case I would refer them to a gastroenterologist to either get a colonoscopy or an endoscopy, whatever is appropriate based on the patient, and rule that out. Even simple things like pancreatic insufficiency. Not a lot of people pay attention to your pancreas. Often they associate pancreas only with insulin, but our pancreas actually produces a lot of enzymes that help us digest our fats and our proteins. And if it's not doing a great job of doing that, you will see patients who see chronic bloating. And this is when we can establish if they actually have pancreatic insufficiency. We can establish a proper dosage for the amount of enzymes they need. People can actually take prescription strength enzymes if they have pancreatic insufficiency. We also want to rule out, the obvious things, like if there is an infection. Sometimes there is an infection. It could be candida overgrowth, but it could also be a parasitic infection that they happen to catch. Now people are not traveling as much, of course, but before that was a factor. If they've recently traveled, and that's what triggered the bloating, then I would ask them where they had traveled, which areas of the world they had traveled to, or even if they had been on an airplane. It's always a good idea to rule out parasites, because they can contribute to having bloating as well. The other thing, and of course, eating disorders we talked about before, there is something called aerophagia, where people eat really fast, or they eat little, but they don't chew their food enough. And that can lead to bloating as well. So that could be a simple reason for their bloating, is they're not eating in a relaxed manner. So even ruling out simple things like that, maybe you need to sit down before you eat. And that may be a thing that will relieve your bloating. If you have a very high level of stress in your job or at home, high levels of anxiety can trigger bloating as well. So that's something that's, again, looking at the whole picture is important, because sometimes it may not be an actual gut problem, but it may be triggered because of anxiety. Because typically when you get anxious, your body doesn't do a great job of producing it goes into that fight or flight mode, and it's not resting and digesting, meaning it's not producing your enzymes optimally, and you can get more prone to having things like bloating or gas. At the same time, it could be something like medication side effects, something that they have started recently recently. And a lot of times people may not connect the dots because bloating may not have been listed as a side effect on their medication. The package that you get with your medication, it might not say bloating, but it might say something like gas, or it might say abdominal discomfort. So that's something to keep in mind as well. If you've started a new medication or even a supplement, the bloating might be a side effect of that. And it might be important to speak again with either your pharmacist or your doctor to find out if that's what's causing the chronic bloating. One condition I did write down here, and that is the small intestinal bacterial overgrowth. It's something that gets underdiagnosed quite a bit, I feel. It's not something that we jump to, of course, initially, because we do want to rule out, like I said, the simple things. And I've listed those on the right side. Maybe you just have, gluten sensitivity. Maybe it's lactose intolerance. Maybe you're just you don't have the right amount of enzymes. If all of that's been ruled out and you're still seeing this chronic, and you've also ruled out the biggies, like you've ruled out you don't have inflammatory bowel disease, you don't have pancreatic insufficiency, what is it that's still causing you to have this kind of gas and discomfort? Then there's something that I look for is small intestinal bacterial overgrowth, which often manifests in different ways. For some people, they have no sensation of gas, but just fullness, or they just see the visual changes, like I don't feel like I have gas, but I can see my abdomen blow up. In fact, patients will show me their before and after pictures of before a meal and after a meal, and you can see how much their abdomen is actually distended. So finding out if you have that is an important aspect too, because if you do, then so the goal of this is to, if there is a chronic problem and you identify the underlying cause, you treat it accordingly. So if they do have small intestinal bacterial overgrowth, you treat that first. If they do have a parasitic infection, you want to treat that first, and that's how you will see a relief of their symptoms. And then you make sure that you follow through, that they don't fall back into the same pattern of getting that infection again. Then it's a question of making sure that their immune system is stable and things like that. And of course, we want to also rule out, if we have ruled out the big reasons, and depending on the severity of the symptoms, you would think about what is actually going on. At the same time, you want to make sure that they don't have just something simple, like I mentioned, lactose intolerance or gluten sensitivity. Those are things that you can easily determine either by doing a food challenge or even by some simple testing. A lot of times it also results, we find that chronic constipation results in bloating. People don't realize that they're constipated, and they just tell me, oh, I feel bloated, I feel bloated. And then when I start asking about their bowel habits, they say, I said, how many times a day do you have a bowel movement? Say, not daily, probably every once in 2 to 3 days. And for some people, that's not abnormal because that's how they have been all their life. But what's happening is that the constipation, they're retaining so much stool in their gut that that's part of the reason that their abdomen is distended. So the point being, when it becomes a chronic issue, it is important, definitely, even though it may or may not be severe enough with blood or mucus in the stools or cramping. If it's happening chronically every week and regularly, you do need to bring it up in your discussion with your doctor to rule out some of these things. It could be something simple, or if it's something major too, if we find out early, we can intervene and make sure that the patient feels better soon.
Okay, so let's talk about the naturopathic way, the remedies that you do and magically treat all of your patients. We have questions coming up, so we will be taking it after her talk. So I just wanted to say that.
Okay. So, of course, this is my favorite slide. So since it's my profession, we always talk about the naturopathic way of treating is to go from least invasive to most invasive. We always want to start with simple therapies. And the reason we want to do that is because we do believe that the body has the capacity to heal itself as long as we give it the right tools and we don't come in its way. And that's something important. I always explain to my patients, it's like, if you get a simple paper cut, or a simple cut on your hand, all you need to do is wash it and keep it clean, and the body will heal itself. You don't actually actively do anything to heal that cut, and it will still form a scab. It's the same idea, but with your entire body. If there is something that it's giving you signals if something is off. So if there is bloating, you know that there is something off in your digestive tract, then you need to pay attention and figure out what's going on and give it the tools. And the tools in this case would be optimize your digestion, whether it's with the use of enzymes or herbs that will maximize your enzyme production. and give it the ability to actually correct the problem. More often than not, we see the body is able to self-correct. And we always start with, we don't want to add, we don't want to do any more harm. So first of all, look at what you're doing currently that might be contributing to your symptoms, and take away anything that might potentially be contributing to symptoms. Investigate underlying cause. We do this as an ongoing process. It's like, okay, maybe it's not the food, or maybe it is the food. So you've eliminated, the notorious foods that cause bloating, but then if you're still getting bloating, we need to figure out if you're not able to digest things properly. Maybe it's not a digestion issue, maybe you have a parasite, so on and so forth. And then, of course, you want to always design a treatment that's sustainable. So, if it's something that a person needs to do lifelong, it has to be a sustainable lifestyle change. And we often help the patient figure out how they can fit it into their lifestyle. And I always keep telling my patients, we have to treat you as a patient and not just your diagnosis. Your diagnosis might be bloating, but as you've seen, we've talked about it, the reason for the bloating might be very different from one person to another. For one person, it might be enzyme deficiency. For another person, it might be a food sensitivity. So you can't treat both the bloating, both bloating symptoms in the same way. You always have to talk to the patient, find out what is it in their life that's affecting their entire health. At the same time, we want to try and make sure that prevention is a major part of the plan. So you don't want the symptoms coming back. So it's all interconnected. If you identify the underlying cause and correct that, then you should be able to prevent the symptoms from coming back. And try to use as much. And when we say increasingly invasive therapies, what that means is that we don't always exclude medication. Yes, medications are to be used as and when needed, and they are therefore at our disposal when you need it. But at the same time, that unless your symptoms are so intense that you need medication directly, there are other ways that you can gently support your body. If those don't work, then we want to progressively increase our invasiveness, like in terms of help that you provide the body, you increase it in intensity. And of course, the long-term goal is patient education and empowerment, which is for the patients to actually be in tune with their body so that they know, oh, when I eat this, this is what causes bloating. Or when I don't get my sleep, those are the days that my digestion is not proper. These are the things that patients learn over time. And that's what I mean by patient empowerment. So they're able to self-correct a lot of these symptoms on their own, including bloating. They identify the patterns. And this is something we do as a team. When patients come in here, we help them identify patterns. Often patients are so involved in, you're going through your life, you may not be able to see the patterns, but as a doctor, and when they're telling me these things, I'm able to identify those patterns because I've seen them before with other patients. And because I know how things can be interconnected, those are the things I would point out, saying, I've noticed you say that every time you travel for work, when you come back, your stomach is not doing so well. And they say, oh, yes, you're right. Like I do see that pattern. So it's about kind of putting patients back in tune, like just having them in tune with their body and how it reacts to different foods, different patterns, different lifestyles, travel, even just anxiety, like different stressful situations. Like every time they have a major meeting coming up with their boss, if that's when they feel like their stomach goes haywire or their bloating gets worse, then they know that's a pattern, that stress and anxiety does affect their bloating. So that's kind of where we want our patients to be eventually, where they know what they can do before they have to call the doctor, that they've already identified it's not a major disease that's causing the issue, that these are the patterns that are causing their bloating, that they can self-correct.
Okay, so what should we do?
And so, so starting with simple lifestyle changes, if, so say you have already talked to your doctor, you've tried a lot of different things, and what are the things that, and now that bloating is still an issue. So we need to figure out what is it on a day-to-day basis. These are some of the common things that we find with patients that work with regards to avoiding bloating. First one is very simple. As you can see, it's just chew your food. And I'm sure you know this by talking to other practitioners and patients, that a lot of people actually these days swallow their food. They're not chewing their food. And this is happening even more now, like with having Zoom meetings back to back with patients who are working from home. They're not really taking the time out to eat lunch. This is something that I always remind my patients: when you sit down to eat mindfully, sleep, even if it's 15 minutes, leave that time aside to actually eat your food, rather than, just gulping down your food, because that doesn't help your body. It doesn't help your body's digestive system. A lot of times people like to chew gum because they have, and it could be for different reasons. Sometimes it's habit, sometimes it's because they feel they have a dry mouth and they need to chew gum to keep it moist. When you chew gum, you are actually ingesting a lot of air when you do that. And that can create just gas. It's just actually literally, ingesting gas, and that's causing bloating. So if you are in the habit of chewing gum, that's something that you might want to change as a habit. Of course, high fat and high carb meal. And when I say high fat and high carb, that the term high is relative for everyone. Everybody's threshold for how many carbohydrates they can eat or how much fat they can eat is different. Again, unique to each body. So, and that's part of training the patient or empowering the patient, is knowing what your limit is. So, you know that if when you eat a certain food, when you eat French fries, you are going to get bloated because your body is not able to handle that kind of fried food. For some other people, it might just be plain white rice. It's like when I eat white rice, I get bloated. So figuring out what high carb or what high fat meals are your triggers, and that's something that you want to avoid on a regular basis if that's what triggers your bloating. And then of course gulping water. I think sometimes I spend a whole visit of 15 minutes talking to my patient about how to drink water, how much water to drink, what time of the day, because a lot of patients, they are aware that they need to be hydrated, but one thing they do is they have their bottles and then they have a timer on their phones or other reminders, and they go in, they gulp down those 2 liters of water, and then for next 4 hours they won't drink water. 4 hours later they gulp down another major bottle. That kind of water doesn't always help, and in fact it can create trouble with things like bloating, because it's just water you're drinking. Your body's not really absorbing that water. You're probably going to pee out most of that. What you need to do is you need to sip water through the day so your body can absorb it. And at the same time, you want to try and drink room temperature water as much as possible. I know it's hard, especially with the weather being hot outside right now, but there is a reason that your body has, very controlled temperature. There is a reason that the body controls the pH of the stomach and your intestinal tract so tightly. And when you drink cold water, that disrupts the pH. So even anybody with a normal chemistry background will know that when the pH gets disrupted, your enzymes are not going to work at the same capacity as they would at an optimal pH. So when you drink water, if you drink too much or too little, it's a problem. And if you drink cold water, that's going to be a problem too. And then, of course, simple dietary things like we talked about, avoiding trigger foods, but alcohol and sodas typically do tend to create more bloating. For patients who are prone to bloating, those are some of the drinks that I always recommend. High sugar drinks and sodas, even if it's a sugar-free soda, the soda itself can create that actually can release gas in your abdomen, and that can add to your bloating. So that's something you want to avoid. Creating a healthy exercise routine. We all know that exercise has many different benefits, not just for bloating, but in fact, for patients with bloating, it's something that helps them release the gas and keep gas under control. Because if they're accumulating gas and they're not passing it, when you exercise, certain yoga poses will help you release the gas too. Anything that will actually help, and we talked about belly massage earlier in a slide too, anything that physically helps to move the gas is also useful. When you have a good exercise routine, it's unlikely that the gas will remain in your gut for that long. And of course, two last important things is keeping a good stress management routine. So everybody experiences stress in a different way, and everybody has a different way to handle it. So if you develop your own ways of, but it doesn't have to be meditation. Meditation sounds like a big word, but it could just be taking a few minutes a day to do some deep breathing that can help you, handle your stress levels. It could be talking to a friend that you enjoy talking to. It could be reading a comic book, or it could be reading something very light that makes you laugh or that keeps your mind away from your heavy everyday day-to-day things. All of these things are effective stress management techniques, and doing all of this doesn't work, then you ask for help. So you definitely want to talk to people. You want to attend talks like we're having today. I'm sure people who are on there, they're looking for answers. So yes, and then you definitely want to seek out help, and you want to ask questions. You want to talk to your doctor as well.
Okay, well, let's talk about some of the success stories that you have had with your clients.
So, I actually chose these two cases because they highlight some very interesting points. We do see, about 50% of our practice is gastrointestinal issues of all different kinds, and bloating is a big one. And if you really look at the statistics, there was a study done in 2011 that showed that about 31% of the American population complains of bloating. And if you look at specifically the IBS population, so about 90% of the patients who have either been diagnosed with IBS or IBS-like symptoms, 90% of them choose bloating as one of their symptoms in their symptom questionnaire. So bloating is really a very persistent problem. It's a very common problem that people experience. So if you look at these two cases, the first one, this was a patient who came to me about 2 years back, and 57-year-old, and so she was already postmenopausal. She had been diagnosed with gastritis, and she had been taking antacids for years, and she'd been on Pepcid for many years, and that was keeping her gastritis symptoms under control. She was, but the reason she was coming to me was because of bloating. She had this discomfort that wouldn't go away, and she constantly had gurgles, and that wouldn't let her sleep at night. That's how loud they were. Like, she would lie down, she would fall asleep, and she would wake up in the middle of the night, and she'd say, "I hear these gurgles." And you know what her backup plan was? She would eat, because that's the only thing that would quieten the gurgles. And then she would go back to sleep. So she had been doing this for years, and then she was kind of frustrated and she was looking for answers. So she called in, and in her intake, I found out that she was already, because she'd had this problem for so many years, she was already well educated. She had tried many different things. She had already eliminated gluten and dairy, which she thought helped to keep her symptoms less severe. And but she said, I still want to see what else I could do. So we ran a few tests for her. One of the things I did was a food sensitivity panel. Because her diet was already pretty clean, I didn't feel the need to, take away things that she might not be sensitive to. And we found that actually she was sensitive to quite a few things, and we eliminated those, and I've listed them in here. We eliminated those as a starter, but I also did a stool test, just to see what else is going on in her gut. She didn't have any infections per se, no parasitic infections, but we did find that she was having a hard time digesting her fats, and she did have some overgrowth of some unfavorable strains in her gut. So that triggered the next test. Because she had this overgrowth of some unfavorable strains, I had her test for SIBO, which is our small intestinal bacterial overgrowth. And yes, she was positive. Once we treated her for that, so for her, in her case, what we ended up doing, because she had suffered for so long, we didn't wait to try any other things. We eliminated those sensitive foods, and we gave her a prescription for the SIBO. Within probably about 4 weeks of her prescription that she had taken for the SIBO, her symptoms turned around magically, you can say, but it was not magically, but she felt different. She's like, "I'm not waking up in the middle of the night. I do hear the gurgles, but they're not as loud. They're not waking me up at night. So I do feel a difference." So within 4 weeks of the antibiotic treatment, she had quite a huge change. And then, of course, it took us a while to rehabilitate her gut, because she did still have trouble digesting fats. So we changed her diet slowly. We gave her the enzymes she needed, rehabilitated her gut to the point. It's been 2 years since then, since her SIBO treatment, and she's eating pretty much everything. And when I say everything, she's even eating, because she was not celiac, and because she was not lactose intolerant, she can even tolerate dairy and gluten in small amounts. And she knows her limits. She knows if she eats above a certain limit, she will get symptoms. If she keeps it within that amount, she's actually able to enjoy all the different foods, even the ones that were on her food sensitivity panel. So she's almost to the point where she calls herself normal. She says, "I don't have symptoms anymore." And when she starts seeing kind of the downhill pattern, she just self-corrects. She's like, "Okay, I get off the gluten and dairy, I get off those sensitive foods, and I get back on track, and I'm fine." So that I think it's a very interesting case to remember, that when there is a need for testing, and when there is a need for using prescriptions, it's important to do it as and when needed. And then the second case, again, you can see a very different demographic, a younger female, a 17-year-old, and she was actually already treated for SIBO even before she came into our office. So she had been suffering with bloating and pain for a while. She had seen a gastroenterologist. She had been treated for SIBO. What she realized was that her pain had gone away after the SIBO treatment, but her bloating remained. That was a mystery to her, and it was about 6 months before she tried different things for her bloating. She waited for about 6 months before she came into our office, and she said, I've tried this and this, nothing seems to change. And what her parent told me, who was in the visit with her, is that she has a lot of anxiety about it, because and these this was one of the patients who brought in a before and after picture. So you can imagine a 17-year-old, she's very conscious about the way she looks. And she said, I actually look like I'm pregnant when I'm bloated. And that's very embarrassing. I don't want to be seen like this with my friends. And so in her case, when we did the full case taking, one thing I realized was anxiety was really high. So we did a lot of mind body work with her. At the same time, simple lifestyle changes were key. So even though she had been treated for the infection, nobody had sat down and asked her how she eats or how she drinks her water. So water intake was critical. She was barely drinking any water. So we got her to incorporate water into her daily lifestyle, made sure that she's eating regularly. Another thing that she was doing was, because she didn't want to get bloated after a meal, instead of having 3 meals a day, she was just snacking through the day. And she thought that would help or prevent her from getting bloated, which was actually doing the opposite. So we had her eat 3 different meals and nothing in between. We gave her that 4 hour gap. And then, of course, like I said, stress management. So a lot of mind body work with her. Just by making these simple changes, we were still waiting for her stool test. By her third visit, she herself used this word, said 75% my bloating is gone. And I don't know, I can't tell you what the pattern is. And I asked her, I said, can you tell me what a pattern is? When are you experiencing it now? She said, no, I still can't tell if there is a specific food that's causing it or not. So then when we received her stool test, we found out that she, of course, was having trouble digesting fat. So even a little bit of fat in the food, it doesn't have to be excessive. Like even if she was having vegetables or chicken sauteed and like cooked in olive oil, she would get bloated because she did have trouble digesting fats overall. As we fix that, her bloating is getting better and better. And she's still an active patient, so we're still treating her, but she's doing every visit I talk to her, she's progressively done better. So you can see like there's a power to lifestyle changes, simple lifestyle changes that can work. And there's also power to using supplements or medication. That really depends on the patient. So you have to treat the patient and not just the bloating.
Okay, so before we open up for questions, I do want to add that Dr. Preeti's treatment approach came into the spotlight when one of her patients published his inspirational weight loss story in a book. And she was also invited to speak at the International Conference for Nutrition and Medicine last year in Washington, D.C. So with that, we are going to open it up for questions. I saw questions coming up. I didn't want to interrupt Dr. Preeti in her talk. So let's see. Okay, so someone is asking, do you think bloating is part of the gut problem? What is leaky gut? What is motility agent? I'm talking magnesium high dose for exercise. Is it related to occasional diarrhea? A lot of questions, Dr. Preeti, for you. So we go one thing at a time. Do you think bloating is part of the gut problem? What is leaky gut? So I'm going to let you answer this question first.
So bloating is definitely, like I mentioned, so if there is a problem in your gut, if you are experiencing bloating, typically there is some form of imbalance in the gut. The trigger might be different. The trigger could be improper fat digestion. It could be anxiety, could be a trigger for bloating, but you're still physically because you're physically experiencing bloating, there's still something going on in your gut that is causing that process to happen. So yes, there's definitely imbalance in the gut. Leaky gut is different from bloating. They can coexist. So a lot of times gut conditions can coexist without being interrelated. And sometimes they are interrelated, sometimes they're not. So leaky gut is actually a different problem where you see that often patients end up absorbing things that they're not supposed to absorb. So our gut is a very tightly controlled environment, and there are very tight gap junctions between our cells. So our body only lets in completely digested foods and nutrients come into the bloodstream. When those gap junctions are opened up wide or damaged because of either disease or certain foods or inflammation, there can be many different reasons. You end up seeing those gap junctions opening up, and the policing of what's getting into the bloodstream is decreased. That's what we call a leaky gut. So things are leaking into your bloodstream that shouldn't be there. So leaky gut by itself may not cause bloating, but yes, over time, the reason that you ended up getting a leaky gut is probably because you're not digesting your foods very well. So the bloating possibly occurred before the leaky gut showed up. They're not, like I said, they're not directly interlinked, but you would have had bloating at some point if you have a leaky gut now.
Okay, please type your questions in the chat window. And also before, you can get a free 20-minute consultation with Dr. Preeti. Yeah, I have the email and our website right on the slide. So because I'm going to stop sharing it so you can, that way you can see Dr. Preeti. So, all right. So what other questions we have? So someone's for exercise. Is it related to occasional diarrhea?
Exercise related to occasional diarrhea.
Yeah, the magnesium. Somebody's taking magnesium, high dose of magnesium supplements for exercise. So they're asking if is it related to the occasional diarrhea? She must be having occasional diarrhea.
I see.
Is it related?
Yes, it could be. It's something you need to speak with your doctor. Depends on what you're classifying as high dose. Like I mentioned, some patients will get diarrhea at 200 milligrams of magnesium. Whenever it comes to dosage, you have to speak with your doctor and you have to make sure that they know how much you're taking. Anytime that you're taking, this is a good point to highlight at this point is that I always tell my patients that supplements are powerful and there's a very fine line between being potent and being poisonous. So you want to be very careful with what you use. Supplements, even though they're very easily available, that doesn't make them less harmful if you're going to abuse them. When you take supplements, even if it's over the counter, make sure that you're following, most supplements that you find in stores, they will have a recommended dose on the bottle. And that reason is considered generally that the reason they have that dose is considered generally safe. But if you are planning to take anything more than that, you have to discuss it with your doctor because it may not be safe for you specifically, and it may not be safe in general. So you need to make sure that you're taking only what your doctor recommends. If you're taking something like magnesium and it's causing, and you are seeing a symptom of diarrhea, yes, there is a high chance they could be interrelated. And there might be another something else that you could take, while you're exercising. Magnesium is not the only option for you. You might need electrolytes. You might need something else that, and also if you take high doses of magnesium for a long time, you can create an imbalance in your magnesium calcium channels. So you want to be careful with that. So you always, even though magnesium is, more than likely it's safe when it's taken at a low dose long term, if it's a high dose, talk to your doctor before you continue doing that long term, especially if you're seeing symptoms.
Okay. And then someone is asking, do you offer online consultation?
Yes, we do. We actually offer, right now, we are doing all our free consults over the phone just because of the COVID situation. Yeah. In normal times, people are more than welcome to come in even for their free consult. But we do offer a 15 to 20-minute free consult where I get to know your symptoms. And if I think I can help, then we can give you more information.
Sure. So I have put down the email. You're welcome to. Any other questions from the audience? I see quite a few people have joined. Dr. Preeti is here to answer your questions. If yes, you can email. And we can, we'll just combine everyone who wants to do free consultation. We'll combine and we'll send it to Dr. Preeti. Any other questions for Dr. Preeti? Okay. All right. Okay. I'm just want to wait before we sign off because sometimes when I'm ready to sign off and then suddenly the questions keep coming. Okay. So I think, well, any other final comments from you, Dr. Preeti? Bloating I feel bloated all the time too. So I do some of the things that you recommended, all the natural things. But I think a lot of people have this issue of bloating. And I personally feel that there's a fine line. You don't know when to call the doctor, but it's really great the way you walked everyone through, like when to call the doctor and when to do it at home. Any other final comments from you before we sign off?
Sure. And one thing I would like to mention, Amita, specifically with bloating, and this is something I see a lot in our practice when patients come in, and often they mention it in their first visit, is I tried everything that everyone recommends online. I know these days there are lots of support groups online, and it's great that we have information at our fingertips, but I always tell my patients, you just have to be cautious when you try something, because just because something worked for another person, it may not be the safest thing for you. So it's always a good idea to keep, whether it's your doctor or you have a nurse practitioner. I know a lot of practices offer, online, like we have a portal for our patients where they can send us quick questions, and we encourage them. So if you read something that you think applies to you, before you try it, if you are my patient, I need to know. Just send me a note and I will let you know whether or not it's okay. And we encourage that. And in general, I encourage people to do that. If you have that kind of communication with your doctor or your nurse practitioner or your pharmacist, even, just talk to somebody who is in the field, because for you, you are an N of one. You are the only patient you're treating yourself. We see a ton of patients, so we've seen the different things, that different issues or challenges that can arise, and that's something that we can guide them with, whether or not it applies to their case. And a notorious supplement here is probiotics. There are tons and tons of probiotics available there. Not everybody needs a probiotic. Not everybody should take a probiotic. And if you should, you need to talk to your doctor as to which strains. So that's something that you should be aware of. And also, I want to thank you for having me here today. It was fun. It was a
Thank
great
you.
experience. So
Thank
thank you
you.
for having me.
There's a comment that's coming up. Someone joined late, so they're saying, would you please summarize what to do when you have bloating again? I would say watch the video. We unfortunately cannot repeat the whole talk. So I'm happy to send a link of the video. I'm sorry you joined late. We are having sessions regularly, so we'll send you the video. Any other comments or any other questions before we sign up? I just want to say that please give us the feedback for all of our sessions. And if you like our sessions, please help us spread the word, share with your family and friends towards going towards natural therapies. With that, I want to thank everyone, each one of you, for joining us. Thank you so much, Dr. Preeti, for being here. Have the rest of the afternoon. Thank you. Bye-bye.
Thank you. Bye.